Okay, this is part 2 of our lesson. I decided to do the pH part separately for a number of different reasons, mostly because my dog was barking. But anyhow, this is very confusing. And it's confusing because the body's so good at maintaining a normal pH level. So if we breathe off, hyperventilate, breathe off too much CO2, which is an acid, right? Then our kidneys start working to retain bicarb. Not great, and that's why you're going to feel faint in the meantime. But overall, especially with chronic conditions, with COPD, chronic respiratory issues, the body's pretty good even if the numbers are off at maintaining a normal level. So this is a picture of the feedback system here. You see the O2, but really for pH, we're really more worried about the CO2 and the pH, not the PO2. Of course, PO2 is important because if you have low PO2 and you're working on anaerobic metabolism, you're going to develop more lactic acid, become more acidotic, that sort of thing. So anyways, that's super important, but for the most part, you're thinking about CO2 and pH. And the pH is regulated by two mechanisms. You have the respiratory component, which is the lungs, and then you have the metabolic component, which is primarily the kidneys. And we will talk about the exchange of bicarb and hydrogen ions in the kidneys in the renal lecture. Let me show you a short video, which actually I think is pretty good at explaining all this.
pH is an indicator of acidity, regulated within a narrow range between 7.35 and 7.45. This is because even a minor change in acidity may have devastating effects on protein stability and biochemical processes. Normal cellular metabolism constantly produces and excretes carbon dioxide into the blood. Carbon dioxide combines with water to make carbonic acid, which dissociates into hydrogen ions and bicarbonate. This is an equilibrium, meaning all of the components of the left and right sides coexist at all times, and the concentration of any component is determined by that of others at any given moment. The rule of thumb is an increase in concentration of any component on one side will shift the equation to the other side, leading to increased concentrations of all components on that side, and vice versa. This equilibrium is central to understand acid-base regulation. Continued carbon dioxide production by all cells of the body drives the equilibrium to the right to generate more hydrogen ions. Because pH is basically a function of hydrogen ion concentration, more hydrogen means higher acidity and lower pH. Normal metabolism, therefore, constantly makes the blood more acidic. The body must react to keep the blood pH within the normal limits. This is achieved by two mechanisms. Elimination of carbon dioxide through exhalation. The amount of carbon dioxide exhaled by the lungs is regulated in response to changes in acidity. A decrease in pH is sensed by central or arterial chemoreceptors and leads to deeper, faster breathing. More carbon dioxide is exhaled, less hydrogen is made, blood acidity decreases, and blood pH returns to normal. Pulmonary regulation is fast, usually effective within minutes to hours. Excretion of hydrogen ions and reabsorption of bicarbonate through the kidneys. The kidneys control blood pH by adjusting the amount of excreted acids and reabsorbed bicarbonate. Renal regulation is slower. It usually takes days to respond to pH disturbances. Although all of the plasma bicarbonate is filtered in the glomerulus during the first step of urine formation, virtually all of it is reabsorbed back into the blood. Most of this reabsorption happens in the proximal tubule. The amount of reabsorbed bicarbonate in the proximal tubule is regulated via a number of mechanisms in response to changes in blood pH. It increases during acid loads and decreases during alkali loads. While the proximal tubule basically returns filtered bicarbonate back to the blood, the downstream collecting duct generates new bicarbonate by acids. As protons are depleted from the distal tubular cells, the equation shifts to the right, producing more bicarbonate, which then exits into the blood. Hydrogen ions secreted into the lumen combine with urinary buffers, mainly filtered phosphate and ammonia, to be excreted in urine. The ammonia buffering system is particularly important because unlike phosphate, which is filtered in fixed amounts from the plasma and can be depleted during high acid loads, ammonia production is regulated in response to changes in acidity, and its concentration may increase several-fold when necessary. Blood pH is the main regulator of acid excretion, but potassium, chloride concentrations, and several hormones also play important roles. Pathologic changes may cause acid-base disturbances. Acidosis refers to a process that causes increased acidity, while alkalosis refers to one that causes increased alkalinity. It's not uncommon for a patient to have several processes going on at once, some of them in opposite directions. The resulting plasma pH may be normal, too acidic, called acidemia, or too basic, called alkalemia. Acidosis may result from inadequate function of the lungs, which causes arterial carbon dioxide to accumulate. This is respiratory acidosis. On the other hand, metabolic acidosis may result from excessive production of metabolic acids, ingestion of acids, decreased ability of the kidneys to excrete acids, or loss of alkali. Metabolic acidosis is characterized by primary decrease in plasma bicarbonate. Alkalosis can also be either respiratory or metabolic. Respiratory alkalosis is caused by increased ventilation, resulting in excessive exhalation of carbon dioxide. Metabolic alkalosis can result from excess loss of acids through the gastrointestinal tract, bicarbonate retention, or ingestion of alkali. Metabolic alkalosis is characterized by primary increase in plasma bicarbonate. Thank you.
Okay, I hope that helped a little bit explain it. I will send the link or put the link in the in these PowerPoint slides so you can watch that YouTube video and complete, since I did have several dog interruptions during the middle of it, so you might want to listen to it a bit better. But it's very good at explaining the process, which is kind of complicated. And like all the other processes we've talked about so far, as we age, we become less good at regulating our pH from a variety of different mechanisms. One would be just the normal aging process. We've caused more damage to our lungs. Our kidneys don't work as well, so they don't help compensate with the bicarb. Hydrogen system as well. A lot of people have abused their body later on. They've done some lung damage, and so they don't work as well either. But even just in the healthy older person, these systems don't function as well as we would like. So here's just a schematic of what's going on there, and I thought this was a pretty good slide. You can take a look at this and see pretty much what we've been talking about during the video and in here. So if this helps you any to figure this out. Anyhow, you can see from an exercise point of view, if you have somebody that's breathing real hard, how they can get into trouble. You have someone that's a smoker and retains CO2, how they can get into trouble. An asthmatic can get into trouble. Somebody with sepsis or hypotension, where they're basically getting into an anaerobic situation, they can get into trouble. And you can also see how this makes a difference with the elderly and the young. The elderly and the very young actually have a lot in common. And the more elderly, the more young, the more in common, really, the more fragile the person is. Anyways, I hope this helped you guys learn a little bit or probably not learned, but reviewed a little bit about homeostasis.